reporting chronicled. 20 black canvas. Okay, so on the ground. We're going to have the worst damage around 20th and Main. We've got whole buildings missing, multiple subjects injured.
Jasco to all stations, fire west. Be advised St. John's was hit in the storm.
So we made the decision, actually that morning on our way down there, that no matter what, we were going to rebuild.
To get the job done, Mercy immediately turned to McCarthy, America's leading healthcare builder and Mercy's longtime trusted building partner.
From the time the tornado went through Joplin, 1 week later, the same time, that Sunday afternoon, Mercy started taking patients in the tent.
So really, we had a field hospital that we put up within a week. We had a portable hospital that we put up right after that, and then a modular hospital we put up right after that.
Collaboration was key to this fast-track project. So I think as we've experienced with McCarthy and how it all came together, working very closely, it was a very successful effort.
Just out of the gate, we brought our historic database of healthcare costs and healthcare schedules. And we worked as a team with Mercy and the design team to focus on, what are the true long-term needs for the region.
So we formed a core team of people, right? A core team of stakeholders from all the entities, the design team, the engineering team, the client team, key subcontractors.
With the accelerated fast track design that was required here, the MEP design assist procurement was by far the only way to go.
Without co-location, I'm not sure we would have completed on time.
Or we were discovering unique site conditions. We were incorporating hardening aspects into the project. We were meeting with a different group of users every week, and making sure that we were designing to their needs.
A project of this size, using our experience on other projects, probably anywhere from 18 to 24 months.
Ground was broken for the new 890,000 square foot Mercy Hospital Joplin on January 3, 2012, and an accelerated construction schedule was underway.
In order for us to meet the schedule requirements, we had to get a jump start on that BIM model, which allowed us to coordinate all the above ceiling MEP systems in order so that there was no clashes when it actually was being put in place.
They had the drawings right there. We had the model right there. They can go look at it in 3D, which really helps them understand what they're building.
We implemented off-site prefabrication really for multiple reasons. One, it helped us level our resources throughout the duration. Two, it helped us improve quality. Three, it helped us reduce costs. And four, it ultimately helped us accelerate the overall construction schedule.
We prefabbed the head walls and we prefabbed also the bathrooms. The carriers, the med-gas piping.
They prefabbed head walls and plumbing and everything, and each trade had to spend a day or two instead of a week or so.
We used mock-ups on the entire exterior skin. Every component that went into this building we mocked up.
We built out a typical patient room. We built out a typical OR room, an exam room, anything that was repetitive.
But it wasn't just about building smarter, it was building a smarter, safer building.
Saving lives is what we're all about in healthcare and taking care of people. So making sure that we're not only taking care of them while they're ill, but that they're protected in this workplace and in this environment so they know when they're here that they're safe.
The majority of the windows in the building are 140 mile-an-hour impact rated. Our critical care defend in place windows are 250 mile-an-hour rated.
With the main mechanical electrical infrastructure all below grade, that is what is essentially going to keep this facility operational if it's ever hit with a future.
Inside, we created areas of refuge, and in those areas we beefed up the light fixtures, the ceiling, the walls in there. We kind of used storm doors in the hallways instead of interior doors. We put battery backup lighting in stairwells, and actually we put UPS systems on all of our life support equipment.
You'd be hard-pressed to find a hospital that has been designed and constructed in this country in the time frame that we have done it here in Joplin.
I've been on lots of construction job sites. There's none that are more clean and organized than McCarthy. And the quality of the work, the way they try to use local craftsmen to bring business into the local economy is phenomenal. And their heart and spirit is just such a kindred spirit to Mercy.
Check your egos at the door, get the design team, get the owner, get the contractor on board early, and work together towards common goals. That's really why this job has been so successful.
Put it all together and the new Mercy Hospital Joplin came together, not just on budget, but under budget. And not just on time, but delivered ahead of schedule. Designed and built in almost half the amount of time of other hospitals of this magnitude.
We needed the expertise and the abilities that McCarthy brought. But they've been such incredibly good partners too that it really has worked out well.
46 months and a day later, a new Mercy Hospital emerged from the rubble and debris. A vibrant new facility serving the needs of Mercy, of Joplin, and the surrounding region.
We serve about 600,000 to 700,000 people in this region. Now we have the most incredible facility that's been built in this entire region. It's awesome.
I think it's more than just a building or just a hospital. I think it means a lot not only to Joplin community, but the entire nation and everybody else that has been hit by a tragedy like this. Oh, I think the people in Joplin are going to love this facility.